Hello, my name's Gill, and I want to talk to you today, just sharing some coping strategies that I've used. And I know they're not necessarily going to be applicable to everybody, but I just want to start a dialogue for looking at a holistic approach to living with long-term conditions. I quite like this song, but actually it's its message that interests me, because my journey through clotting has been like a roller coaster. And I'm not very good with roller coasters. I hate them, in fact. And what I dislike is not being in control. And my journey with clotting started in 1992. I had sagittal sinus thrombosis, which is a bleed in the brain. And my main coping mechanism, particularly in the crisis time, was my 2-year-old son, who's now 24. And I didn't want my husband to have to bring him up without a mother, and I definitely didn't want my son to have to be brought up without a mother. My recovery was really difficult. I was supported by a medical team and an amazing family. But I had seizures, which have subsequently turned into epilepsy. And I also suffered with temporary paralysis from a stroke. I was 9 weeks pregnant when it happened. And I did have a very complex pregnancy and spent most of that time in hospitals. Once my daughter was born, I had a 2.5-year-old and a new baby. I didn't even have time to think about coping strategies. I just had to get on with it. And 18 months later, I went back to work, and you'll notice throughout my speech that actually that's been my default coping mechanism. In 2004, I was in hospital for approximately 6 months, various different hospitals. And in February of 2005, I was transferred to Papworth Hospital in Cambridge, where I was diagnosed with CTEPH, which is chronic thromboembolic pulmonary hypertension. And I was offered an operation. It was called a PTE then. It's now called a PEA. And it's a pulmonary endarterectomy. What basically it does is remove organized clots that have become fibrous from your pulmonary arteries. But I had about a month where I had to be stabilized to be well enough to have this operation. And the team there, particularly the palliative care team, suggested some ideas for my family. They suggested music. I love music. I had calming music. It was great. They suggested CD for pain relief, and also guided meditation. And in that crisis month, I found them really useful. I must say that I had an amazing family, and that's been, throughout my journey, one of the most amazing coping mechanisms. And I'm not saying this just because he's here, but I would say that my younger brother kept us all together because we were falling apart. It was hard. After my operation, I made a miraculous recovery. I was delighted. I could go cycling, I could go swimming, I could play tennis. And all of these things really helped me to get back my strength. By this time, I was head of languages at a local secondary school. And 4 months after my operation, well, I just threw myself into work because that's what helped me cope. Unfortunately, though, in 2008, my pulmonary hypertension symptoms recurred. And this was really demoralizing, obviously, because I knew I wasn't cured from PH, but I thought I had, a really good lease of life, as it were. The team at Papworth discovered that my clotting was reoccurring, And I was really fortunate because I was referred to Prof. Hunt and her team, who diagnosed me with APS. I had to have my blood stabilised before I could have a redo PTE. Now, I believe at the time, this had only been done once before in the UK. So it was frightening on the one hand, and yet I just assumed that I'd recover like I had before. I had amazing support, which again is a coping mechanism really from the guys in St. Thomas's team and also from Papworth. But the outcome of the operation wasn't as good as my first one. But I went back to work. I sort of slapped on my mask of positive mental attitude and tenacity, and however, I was finding it emotionally quite difficult. And I guess I was just avoiding the issue of feeling so emotional. It's sometimes amazing how your medical team identify things in you sooner than you do yourself. And the palliative care nurse at Papworth suggested the EPP. It's an expert patient program. It's a 6 weeks course, and once a week you go for a session. It's delivered by volunteers who have chronic long-term conditions. So everybody in the room has got a different chronic condition, but it's giving people just the strategies to sort of self-manage the issues and the challenges that we all faced. There was a long list, and I was delighted to get a textbook. Being a teacher, that was one of my favourite things. But one of the things that I really found useful was there was a session on managing fatigue. By now, my children were teenagers. I was working full-time, and I struggled with fatigue. And they gave me some ideas of how to cope with that better. Another one of the sessions was on understanding emotions. And I felt quite happy to discuss with my family and my friends and healthcare professionals about how I was feeling physically. But I wasn't very good at explaining how I felt emotionally and the impact that all of this was having on me. In 2012, I had a particularly difficult period because despite all the medications that I was receiving from Papworth and from Guy's and St. Thomas's, clots were still forming and my pH was deteriorating. And the only thing I can describe this as is complete and utter despair. I had a change in medication, which had some rather nasty side effects. And in some respects, I luckily needed a bit of time off work. But actually, my husband and I couldn't look at each other without crying. All the coping mechanisms that I'd used previously just weren't working. But eventually, after about 3 or 4 weeks, I decided this is stupid. I've got to go back to work. I've just got to try and put it out of my mind. And the next coping mechanism that I sort of discovered was in September of 2012, Professor Hunt and her team decided that it might be a good idea for me to try a fortnightly infusion at Guy's to see whether or not it might help my blood stop clotting. And it did seem to start to work. And I guess what I'm saying here is that even when things feel completely and utterly, desperate, the medical teams that look after me will do absolutely everything they can to try and help you cope with that challenge. There's new medicines, there's new research, new procedures, and I have to have that faith in those teams that they'll help me. But something else I learnt is that sometimes we just don't have a coping mechanism for a challenge that's thrown up against us, and that's okay. You need to give yourself time. You need to perhaps adapt some of your previous coping mechanisms and develop something different. I felt much more positive in 2013. I read a book called Full Catastrophe Living by an American professor called John Kabat-Zinn, and I discovered mindfulness. Now, I'm not going to go on too much about mindfulness because I realised that we have a session this afternoon. I found it hard work initially, but it was worthwhile. The CD helped an awful lot, and the mindfulness-based stress reduction that he discusses, I think he used initially for cardiac patients, along with other conditions such as MS and also and depression. And he talks about participatory medicine, a sort of a mind and body integrative medicine. And it made me realise that all the coping mechanisms that I'd used in the past had been diversion or denial. And actually, I began to realise through the practice of mindfulness that I could actually take more active control. I like control, active control in my health. Now, another thing that was suggested to me was to look at some group support. And I duly joined various different groups, social media, forums. And some of these have been really helpful. I would just, for myself, give a bit of a cautionary note. Sometimes what this does for me is it makes me overthink and obsess about my illness. And I have to take a bit of a break from the kind of groups and things, but that's perhaps just me, I don't know. You're probably going to think I'm absolutely bonkers, and whilst that may be true, this is my dog. In 2013, even though my APS was being stabilised by my continued infusions, I began to realise that my main coping mechanism, which was work, was getting more difficult. And both of my children are by this time long left home, and everything felt a bit empty. So I decided that we should rescue a dog. And I couldn't have realised then what an amazing support she is to me. I call her Ollie therapy because I know I have a lot of medications. I know they really help me. But when things are really tough, just sitting with her sometimes really helps. So, like I say, you don't all need to rush out and get a dog, but for me, it really worked. Last year, I'd been asked for quite some time to give up full-time work, but I'd resisted. But I was told that I needed to go through the process of ill health retirement, which I'm still doing. But I decided, right, okay, I need to keep busy, and I love languages, so I decided that I would use an app called Duolingo, and I'd teach myself Italian, which I'm continuing to do. A friend introduced me to Zen doodling, and I'm not artistic at all, but as a child, I really liked colouring in. It was really absorbing, and it took your mind off other things, and that's what I find Zen doodling does for me. I don't really want to talk about the knitting because that is more stress-inducing for me than stress-relieving, but I will persevere. But all of this, if I'm honest with you, was throughout the winter months, and it all seemed a little bit bland compared to what I was doing before. And also, I had more time to think, because I wasn't at work, thinking of loads of other things, and I felt like I was living my life in limbo. It was really, really overpowering, and I wanted a prognosis. I wanted to know, which sounds quite morbid, but I wanted to know how much longer I had left to live. Obviously, doctors can't give you prognosis necessarily because medicine is evolving all the time and, various different things come up and who knows whether that might be able to help me. But my pH was definitely, deteriorating and I found that hard. But again, Papworth's team recognised this sort of dilemma, and I was referred to a pH specialist clinical psychologist. And in discussions with her, she sort of helped me to see the irony, really, of my job title. Because previously, I had been a transition and induction leader. I'd supported Year 6 students going into Year 7 and 8. I had tailored an individual program as we got to know the students. They did a variety of different activities, and I'd organised all that. And I realised that different students took different times and different strategies that they needed to basically go into a new phase of their life. However, I could do that for other people. Well, I couldn't do it for myself. I was expecting me to go from, working full time into considering ill health retirement overnight. And I realised that actually I needed to just give myself that time to get used to a different phase of my life. I've never found change easy. I think it's hard. And there is a cycle that you go through when you have changes in your life. And I would say currently, I'm at a pretty messy stage. I'm neither one nor the other at the moment. But I am really positive about going into what they describe here as the gorgeous stage, because even though I know I will face new challenges as a result of my conditions, I really, really want to focus on being flexible in order that I can always develop my coping strategies as I go along. In conclusion, there are a number of things that I see in various different places that give me strength and the way to cope. I realise that some of the coping mechanisms I've used have been really positive and some not so, in fact, some quite negative. And it's the one in quotations here, "It's life but not as we knew it," that was coined by a friend of mine with PH. And the way I look at that is that there is no point in me spending energy on looking at the past. I could stand here for hours and tell you all the different things that I can no longer do. But that's wasted energy. I also know that looking to the future and thinking, well, what am I going to be able to do this time next year, or if this happens, or if that happens, that's also a waste of energy. I know it's not always easy, but I know that I have to live in the present, because actually that is my only option. And also, I know that I have to be really grateful for what I can do at the moment. Thank you for listening.